Rheumatoid arthritis is an inflammatory form of arthritis that causes joint pain and damage. Rheumatoid arthritis attacks the lining of the joints, the synovium, and causes swelling that can result in aching and throbbing and eventually deformity. Sometimes rheumatoid arthritis symptoms make even the simplest activities, such as opening a jar or taking a walk, difficult to manage. Rheumatoid arthritis is 2 to 3 times more common in women than in men and generally occurs between the ages of 40 and 60. But rheumatoid arthritis can also affect young children and older adults. There is no cure for rheumatoid arthritis. With proper treatment, a strategy for joint protection, and changes in lifestyle, they can have a productive life with rheumatoid arthritis. Rheumatoid arthritis occurs when white blood cells, whose usual job is to attack unwanted invaders like bacteria and virus, move into the bloodstream into the membranes that surround the joints, which is the synovium. The blood cells appear to play a role in causing the synovium to become inflamed. The inflammation causes the release of proteins that over months or years causes the synovium to thicken. The proteins can also damage the cartilage, bone, tendons, and ligaments near the joint, and gradually the joint loses its shape and alignment, and eventually it may be destroyed. Rheumatoid arthritis is a chronic inflammatory disorder that most typically affects the small joints in the hands and feet. Unlike the wear and tear damage of osteoarthritis, rheumatoid arthritis affects the lining of the joints, causing a painful swelling that can eventually result in bone erosion and joint deformity. An autoimmune disorder, rheumatoid arthritis, occurs when the immune system mistakenly attacks the body's own tissue. In addition to causing joint problems, rheumatoid arthritis can also affect the whole body with fever and fatigue. Signs and symptoms appear in smaller joints first. Rheumatoid arthritis usually causes problems in several joints at the same time. Early rheumatoid arthritis tends to affect the smaller joints first, the joints in the wrist, hands, ankles, and feet. As the disease progresses, the shoulders, elbows, knees, hips, jaw, and neck can also become involved. Rheumatoid arthritis signs and symptoms may come and go. They may have periods of flare-ups or relative remission, during which the swelling, pain, difficulty sleeping, and weakness fade or disappear. Diagnosing rheumatoid arthritis usually begins with a physical exam. People with rheumatoid arthritis tend to have an elevated erythrocyte sedimentation rate, otherwise known as a SED rate, which indicates the presence of an inflammatory process in the body. Other common blood tests look for antibodies called rheumatoid factor or anticyclic citrullonatic peptide anti-CCP antibodies in the blood. While commonly found in the blood of people with rheumatoid arthritis, rheumatoid factor and anti-CCP antibodies aren't present in all cases. In early rheumatoid arthritis, the presence of rheumatoid factor and anti-CCP antibodies in the blood may be associated with an increased risk of joint damage. Rheumatoid factor and anti-CCP antibodies can be present in people who have chronic infections such as active tuberculosis or other autoimmune rheumatic diseases such as lupus and Sjogren's syndrome. Joint fluid analysis is done to rule out other diseases and conditions. X-rays are done to help track the progression of the rheumatoid arthritis in the joint over time. Can also be abnormal in other systemic autoimmune and inflammatory conditions. So abnormalities in these blood tests alone are not sufficient for a firm diagnosis of rheumatoid arthritis. The diagnosis will be based on the patterns of symptoms, the distribution of the inflamed joints, and the blood and the X-ray findings. Joint X-rays may be normal or only show swelling of soft tissue early in the disease, and as the disease progresses, X-rays can show bony erosions typical of rheumatoid arthritis in the joints. Bone scanning and radioactive procedures are also done to show inflamed joints. Abnormal antibodies can be found in people with rheumatoid arthritis. An antibody called rheumatoid factor can be found in 80% of patients. Another antibody called the anti-nuclear antibody, ANA, is also frequently found in people with rheumatoid arthritis. Blood testing may also reveal anemia, since anemia is common in rheumatoid arthritis, particularly because of chronic inflammation. Non-steroidal inflammatory medications can relieve pain and reduce inflammation. Over-the-counter medications such as ibuprofen or naproxen can be given. Stronger versions of these non-steroidals are available by prescription. Nonsteroidals have risks of side effects that increase when used at high dosage for long-term treatment. Side effects could include ringing in the ears, gastric ulcers, heart problems, stomach bleeding, and liver and kidney damage. Drinking alcohol or taking corticosteroids while using nonsteroidals can also increase the risk of gastrointestinal bleeding. Steroids could be ordered as well, such as prednisone and methylprednisolone, and they reduce inflammation and pain and slow joint damage. In the short term, corticosteroids can make you feel dramatically better, but when used for many months or years, they may become less effective and cause serious side effects. Side effects include easy bruising, thinning of bones, cataracts, weight gain, a round face, and diabetes. Corticosteroids are often given to relieve the acute symptom with the goal of gradually tapering off the medication. Disease-modifying anti-rheumatic drugs, DMARDs, limit the amount of joint damage that occur in rheumatoid arthritis. They are typically used in the early stage of rheumatoid arthritis in an effort to slow the disease and save the joints and other tissues from permanent damage. They may need to take these medications for weeks or months before they notice any benefit. For that reason, they may be combined with other medicines that will give a more immediate relief, such as nonsteroidals or corticosteroids. Immunosuppressants act to tame the immune system, which is out of control in rheumatoid arthritis. In addition, some of these drugs attack and eliminate cells that are associated with the disease. Some of the commonly used immunosuppressants are listed. These medications can have potentially serious side effects such as increased susceptibility to infection. TNF-alpha inhibitors is a cytokine or cell protein that acts as an inflammatory agent in rheumatoid arthritis. TNF inhibitors target or block this cytokine and can help reduce pain, morning stiffness, and tender or swollen joints, usually within 1 to 2 weeks after treatment begins. There is evidence that TNF inhibitors may drastically slow the progression of the disease. These medications are often taken with methotrexate. Potential side effects include injection site irritation, worsening congestive heart failure, blood disorders, lymphoma, demyelinating diseases, and increased risk of infection, including serious infection leading to death if treatment is delayed. A balance of rest and exercise is important in treating rheumatoid arthritis. Heat is applied for comfort, and during flare-ups, which is a worsening of the joint inflammation, it is best to rest the joints that are inflamed, and cold is for the exacerbation of this disease. When joint inflammation is decreased, guided exercise programs are necessary to maintain flexibility of the joints and to strengthen the muscles that surround the joints. Range of motion exercises should be done regularly to maintain joint mobility. Swimming is particularly helpful because it allows exercise with minimal stress on the joints. Physical and occupational therapists are trained to provide specific exercise instructions and can offer splinting supports. Devices such as canes, toilet seat risers, and jar grippers can assist in the activities of daily living. Rheumatoid arthritis treatment is directed at relieving pain, reducing inflammation, slowing down or stopping joint damage, and improving a person's sense of well-being and ability to function. It is particularly important that patients with rheumatoid arthritis eat protein and calcium to prevent anemia. Eating small, frequent meals, taking vitamins, and consuming nutritious snacks can help provide the nutrients patients with rheumatoid arthritis need. These patients will need to abstain from drinking alcoholic beverages to prevent liver damage. Many people with rheumatoid arthritis keep painful joints in a bent position because it feels more comfortable. However, joint contractures can develop quickly. Passive range of motion exercises can be done without any effort by the patient and can preserve joint mobility and prevent contractures. As joint inflammation decreases, the patient can perform active range of motion exercises under the direction of a therapist. Isotonic and isometric strengthening exercises are done to preserve and improve the ability of the muscles to do their work. An isometric exercise, such as quadricep setting, contracts the muscles without moving the joints. Isotonic exercises, in which the joint is moved, are done carefully in people with rheumatoid arthritis because they require repetitive joint motion. For severely inflamed joints, splints can help resolve inflammation and keep joints in a functional position. Rheumatoid arthritis treatment and management depends on collaboration between the patient and the entire healthcare team. The focus of nursing care is to help patients live a healthy and satisfying life with rheumatoid arthritis. Through education, nurses can help patients and family understand the disease process and its effect on the entire family, and to appreciate the chronic and unpredictable nature of the disease. Fatigue and sleep deprivation may make pain seem worse and more difficult to control. Over-the-counter topical creams containing capsaicin may temporarily relieve pain. Capsaicin is an alkaloid derived from plants and the active ingredient in hot peppers. The disabling effects of early morning stiffness can be relieved by taking non-steroidals and using an electric blanket before getting out of bed and taking a warm bath to loosen the joints. A chronic disease such as rheumatoid arthritis may produce feelings of powerlessness. Patients who can view their relationship with rheumatoid arthritis as an evolving partnership have better physical and psychological outcome than those who view rheumatoid arthritis as the enemy. An important intervention for powerlessness is to increase the patient's participation in decision-making by allowing them to make as many choices as possible. Nurses can also help patients exercise control by suggesting that they keep a medication notebook to record essential medication information that can be given to other healthcare providers. Surgery may be recommended to restore joint mobility. Or repair damaged joints. The type of surgery can range from arthroscopy to partial and complete replacement. Arthroscopy is a surgical technique where they insert an instrument to see and repair the abnormal tissues. Total joint replacement is a surgical procedure where a destroyed joint is replaced with artificial materials. Tendon repair is inflammation and joint damage may cause tendons around the joint to loosen or rupture. They may need to repair the tendons around the joint. Removal of the joint lining, synoviectomy. If the lining around the joint is inflamed and causing pain, they may recommend removing the lining of the joint. And joint fusion, arthrodesis. Surgically fusing a joint may be recommended to stabilize or realign a joint and for pain relief when a joint replacement isn't an option. Looking at the difference between osteoarthritis versus rheumatoid arthritis. Osteoarthritis is degenerative joint disease. The wear and tear arthritis affects mainly the joints and a gradual thinning of the cartilaginous tissue. Rheumatoid arthritis is chronic inflammatory type of arthritis. Autoimmune disease affects the joints and in later stages affects the organs. The inflammation and pain occurs before cartilage cushions are damaged. Septic arthritis may develop when an infection elsewhere in the body, such as an upper respiratory tract infection or urinary tract infection, spreads through the bloodstream to a joint. Less commonly, a puncture wound, drug injection, or surgery near a joint may allow bacteria. The lining of the joints, the synovium, has little to protect itself from infection. Once bacteria reaches the synovium, the bacteria can enter easily and begin destroying the cartilage. The body's reaction to the bacteria causes inflammation around the joint and increases pressure and reduces blood flow, which contributes to the damage of the joint. A number of strains of bacteria can cause septic arthritis. The most common type involved is Staphylococcus aureus, or a staph infection. In the past, septic arthritis was more frequently caused by the bacterium that causes the sexually transmitted disease gonorrhea. But the use of safer sex practices has led to the decline in gonorrhea and its complications, including septic arthritis. Still, in younger, sexually active people, gonorrhea is a potential cause of septic arthritis. Bacteria are just one cause of joint infections. Viruses also can attack joints, viral arthritis, though this condition usually resolves on its own and causes little joint damage. In rare cases, joint infection can be caused by a fungus for fungal arthritis. Another infectious type of arthritis is reactive arthritis, which causes joint pain in response to an infection in another part of the body, though the joint itself is not infected.